it has been it's been an incredible year, what we've all gone through. I think with ILCA having, it's tough having a virtual conference and having a conference where they did both, and with what was going on with COVID. So I think ILCA did a pretty good job all around, and it's the fact that they had so many options of international languages. That I'm really proud of. I'm really happy on that part. So I would like to say, cheers to everybody. And we are here to celebrate what we do, celebrate, the families we help, and to celebrate each other. Because without each other, we're not going to get anywhere. Okay? So, salute.
Salute. Cheers.
What I had asked a couple of the tutors to do was to listen to some of the presentations and to actually see if they would just come and talk a little bit. So because I know there's some of you that may have attended ILCA, some of you may not have attended ILCA. So I'm actually going to ask Valerie first, if she doesn't mind, to actually just give a bit of an overview of one of the presentations that she saw. And that way we can get a bit of an idea of, for those who didn't attend ILCA, to hear what actually was going on there. Everyone's okay?
Oh, I just want to plug a little thing that we did for you, which might help those of you either to follow along or to check later. After we finished tweeting Carol, we created these collections, and there's a tweet collection for every one of the virtual sessions, so you can kind of see the high points on Twitter. So I'll just go find the link to that and
pop
as we talk, I'll pop it in. Yeah,
that would be great. So I'm just going to pop this to speak of you just for a second, so that when Val speaks, we can see her. Okay.
You're going to put me in big screen here?
Yeah.
Oh my God. I'm super exhausted. It's all good. So do you want me to start?
Yeah.
Okay. So I'm being a chiropractor. I did one of my first research paper that I published was on the use. It was a retrospective study of 25 ladies where we used ultrasound therapy on blood ducts. So I've been using ultrasound therapy for a long time on my patients with blood ducts with amazing success. So I was quite interested in hearing Katrina Mitchell talk about her talk was about plug ducts, mastitis, how she treats it. So I encourage you to go listen to it because it was quite interesting on many views. One thing that was striking to me is usually in all the stuff all the different ways of treating plug ducts, I've always seen massage, and she is advocating that we should not massage at all. And actually that when we massage, we actually create more inflammation in the area, which then creates more edema, which then creates more blood duct and more issues, and it heals less fast. And then it can trigger this chain down, which may be one of the reasons why people end up with mastitis or abscesses later on down the road. So our big take-home message was that we should treat this as an inflammatory process. And the way she has this great analogy where she describes it, that if you keep always pumping to empty and massage and stuff, that you create more, like instead of using the feedback inhibitor of lactation to kind of try to tell the breast to stop producing. She strongly believes that all this is linked to an oversupply, either in the whole breast or certain parts of the breast. And that if we tell the moms to really pump to empty, we actually create more of an issue because we bring, she calls it more cars. So there's more cars into the little freeway. And then because there's inflammation, the cars get more congested, which then creates the issue. So she says that we should really treat it more as an inflammatory process and right away be quite aggressive. Let me pull up my notes. I did take some notes, Carol.
Good.
So the take-home points of our presentation that we should treat it as like physiologically feeding. So do not try to empty, but treat it like feed for what the baby needs. She talks about eliminating excessive pumping, no massage, because when we massage, there's tissue trauma, which then worsens the inflammation. And then she has this thing called, she calls it HAI, but it's basically like you treat it with heat a bit, acetaminophen, ibuprofen, and ice. So a lot of anti-inflammatory agents right away aggressively. She's quite aggressive right away to use therapeutic ultrasound as well. And then she was talking about different ways of draining, which was more specific to surgeons and stuff. But I thought that was quite interesting. So definitely to treat the inflammation right away aggressively. So just a lot of ice and anti-inflammatories and the ultrasound to help decongest and help heal. And she also on her website, she showed, and she's big into lymphatic drainage massage. So it's not deep tissue massage like we used to do. I do see some moms that come in, they're all like they're bruised, you sit on the breast and it's actually, I'm like, oh my gosh, is this red because you've been rubbing, or is this red because it's turning into mastitis? So she describes, if you go on her website, she has a really nice diagram where she shows on just very light petting and how to do the lymphatic massage so that the moms can do it themselves. So I really enjoyed that presentation actually. So that's it.
Yeah, that was, I haven't seen it yet. This is one of the on-demand ones, right?
Yeah.
So I think Yvonne can say, we met her last year in New Zealand. So, and I know that
in my guest room too.
Yes,
not the same time as Carol.
So it is a very small world when you mentioned that. Oh, that's the one you were listening. I said, oh, is that her? Yes.
Actually, I forgot to tell one thing, Carol. The other analogy that I liked, she said that we should treat, because the breast is a gland. We should treat it like a sprained ankle. And when you say that to people would probably realize, like, how do you treat a sprained ankle? You put, cold. I always use this analogy with back pain because a lot of people come in with back pain and they go in the bath and then they can't walk the next day. So I said, if you were to sprain your ankle, what would you do? And they're like, oh yeah. So when she said that, it totally resonated with me.
Yeah,
so.
it made sense to you.
Mm-hmm.
Yeah, that's really good. So I was going to say, does anyone have any comments about, or has anybody else, if you've attended any of the ILCAs, any of the ILCA sessions, if there's anything that you'd be interested to share? I've got some notes of what I did, but I'll give everyone a chance first, because I'm always keen on the things where we talk about code and things like that. So, but does anyone have any comments? Yeah, go ahead, Lenore.
On Katrina, because I think she's opening up a very important avenue for us.
Yeah,
because she is a breast surgeon,
Mm-hmm.
and in my world anyway, breast surgeons know about breast cancer, but they have no interest or knowledge of breastfeeding. So she is now the official teacher of the American Academy of Breast Surgeons. Mm-hmm. So, and she has the anatomical knowledge of the breast. And I don't know if she showed this, Avro, of the picture of the diameter and the tiny little thread-like things that are actually ducts.
And she was showing parts when she does the surgery, and she kept comparing to calamari. She's like, this is like very stiff calamari. This is a gland. Anyway, it was really nice photos in the presentation.
It's great. Yeah. So she's doing a lot for all of us, really.
Yeah, I found her really interesting last year because it's the first time I'd heard her in New Zealand, and I realized, yes, she'd been staying with Yvonne and everything, but it was. I thought, wow, this is a very a totally different view, because so often, like you're saying, Yvonne, is that you have people that are not at all really in our field.
I was going to say, I emailed her also because I was discussing the parameters with her of the therapeutic ultrasound that I use and I didn't know she had seen my study. So I sent it to her, and I was actually impressed. Less than 24 hours, I got the response today, thanking me for the research I sent her and how she found her study, like her parameters, and that she does use continuous ultrasound as well. That's the way I use it too. So it was really, I was surprised, the surgeon, super busy, replied to me within 24 hours. So.
Lenore, is there anything you wanted to share about any of the presentations that you saw?
There were two today that were really wonderful. Ever since we have this discovery of secretory IgA and the immune factors, it's sort of stuck there. But now with COVID, there's been an influx of research. There's been about 20 papers, and one more than the other. And the most recent one, I think, was actually a level 1 paper, random controlled. And so there were two presentations. One was by Dr. Chrissy de Lador, I think from your neck of the woods, Yvonne. I'm not sure. And then the other one was
from the UK.
Oh, is she from the UK? Okay, well, I missed the very first slide, but that accent sounded a bit New Zealandy to me. And then the other one was Dr. Meliana Vargas, and both of them talked about the immune system, and both of them used really wonderful illustrations, far more sophisticated than what we're used to. We all remember the Neville, the original ones, but now because of COVID, they have delved into breast milk and the protection, and actually the last speaker changed her title because she was saying possible protection, and now it's actual protection, because we've got more from the time she handed in her slides till now, they proved it. So we have really, both of them talked about secretory IgA, IgG, and very interesting results, research coming out. Because, there are still a lot of women afraid to get the vaccine, afraid to breastfeed with the vaccine, afraid to have COVID and breastfeed. And pretty much in all these cases, the recommendation is to breastfeed. So even if she has COVID, to do mask and, precautions against horizontal transmission, because to get vertical transmission is virtually nil. So if she's pregnant, she's not going to transmit. If she gives birth and breastfeed, she's not going to transmit. They've found antibodies in breast milk that kill COVID. And this protection goes for sure 6 months, and they're thinking it may go on to a year, but right now for sure 6 months. And because the babies are too young to get the vaccine, and it's nice to know that you can protect them and be there for them with your breast milk, and that the rates of antibodies are even higher if the mother is vaccinated. So there's so many women in the news just in the last 2 weeks, 2 mothers that died. One of them, her baby didn't survive, that died because of COVID, because they're afraid of the vaccine. So the word has to get out that really everyone is, World Health Organization, CDC, everyone is recommending they get the vaccine, and they're recommending that they breastfeed.
Both of those, I felt the same way, Lenore. I think those were both excellent presentations. And the second one from Vargas, Mary Elena. Yeah. That one, she does, it may not have been there when you first logged in, but at the end, her slides are now available. If you go into the site and click on her presentation, you can see all of the
slides are available, but they're not the same slides she presented. But let me just say that the research studies that she just cited, they'll be in her presentation, and I strongly encourage you to take note of those, especially the last one, which is a level 1 research study. Was it Schatz? I can't remember, but it's the level 1 research study, and it was phenomenal.